Ije kama ki gbogbo wa kú dédé àsìkò yìí, a kú ìrọ̀lẹ́, a kú kòlẹ́dà tí gbogbo wa bá kiri, a kú ìsinmi òní, bó ni ṣé gbogbo ẹ̀ ń lọ bá ṣe kọ̀wé ẹ̀. Ẹ káàbọ̀ sórí àkọ́tún ètò tó rí sí ìlera wa, ètò tó ń fún rere bí a ṣe wà lálàáfíà ara, ètò tá a pè ní Faysol Oluwakemi Health. Àkọ́tún náà ni ó tún jẹ́ lénìí lágbára Ọlọ́run torí a tún láǹfààní láti tún ṣe àgbéyẹ̀wò àwọn nǹkan kan èyí tí ó tún ní ṣe pẹ̀lú ìlera wa lórí ètò yìí bí ìṣe wa. Àwọn nǹkan wọ̀nyí náà la máa láǹfààní àti gbéyẹ̀wò gẹ́gẹ́ bẹ́ẹ̀ ṣe mọ̀ pé lórí ètò Faysol Oluwakemi Health níbẹ̀ láti máa ń ṣe àgbéyẹ̀wò gbogbo nǹkan tí ó bá ní ṣe pẹ̀lú ìlera wa bá ṣe wà lálàáfíà, èyí tí a sì máa ń gbé àwọn àlejò wá lọ́lọ́kọ̀ ọ̀jọ̀kan lórí ètò tó ṣe pé àwọn àlejò wa wọ̀nyí náà ni wọ́n máa ń bá wa sọ̀rọ̀ ṣàlàyé ní kíkún nípa àwọn nǹkan tó yẹ ká mọ̀ nípa ìlera wa. Faysol Oluwakemi ló kọ tèmi, Dokitomoye atọ́kùn ètò Faysol Oluwakemi Health. Gẹ́gẹ́ bẹ́ẹ̀ sì ṣe mọ̀ pé lórí ètò yìí èdè méjì la máa ń lò, èdè Gẹ̀ẹ́sì àti èdè àbínibí wa. So on this note, I want to welcome you to another interesting episode of Faysol Oluwakemi Health. As all know, on this program is where we discuss everything and anything that deals with our health so that we can know latest updates on our health, so that we can know how to live a healthy lifestyle and also what to do and what not to do as regards our health. On today's program today is gonna be very, very interesting as usual because we are channeling our discussion today. We are focusing on something very, very important. So as you can see, our topic for today is menopause, transition, and its challenges. You know, as regards menopause, there are a lot of controversy, argument about menopause. When a lady gets to this stage of life, there are some things that they won't have chance to be doing, especially when it comes to sexual intercourse, enjoying sex. When some people say when you have reached the stage of menopause, this and that, that and this. So all these things are what we'll be focusing on the program today. And I have my guests with me already, so that when it's time, we are going to launch our guest on the show. So you know how we do it on this program. As you are watching us live now, I want you to just please drop your name and your location as a comment, so that anytime as you are watching us, so that we can appreciate everybody joining us right now. So your name and location, let us know where you are watching us from, so that we can appreciate every one of us. So you can as well tell us the reception, how you are viewing us, how you are hearing this audio output, so that if there is need for us to do something very, very important. So I can see some people joining the live broadcast right now. So as you are joining us, please drop your name and location, so that we can appreciate those who are joining us already. So my guest is on the program today in the person of Dr. Epetimehin. Dr. Epetimehin is online with us. So any moment from now, she will be joining us. She will be joining us. So Dr. Epetimehin is our guest for today. So when it's time, I'm going to introduce our guest per se on the program. So my guest on the show, as you can see, she is on the screen right now. She'll be joining us on the screen right now. So that is our guest in the person of Dr. Epetimehin. So àlejò wa lórí ètò fún tòní, àwọn náà ni dókítà onímọ̀ ṣègùn òyìnbó dókítà Epetimehin. Àwọn náà ni wọ́n máa bá wa sọ̀rọ̀ ṣàlàyé nípa nǹkan tí a fẹ́ gbé yẹ̀wò lórí ètò Faysol Oluwakemi Health fún tòní. Àlejò wa, ẹ káàbọ̀ sórí ètò ọ̀hún. You're welcome to Faysol Oluwakemi Health. Ẹ bá wa káwọ́ èèyàn kan lè mọ̀ pé tí wà ń kalẹ̀.
Ẹ ṣé mo dúpẹ́, ẹ kúrọ̀lẹ́ gbogbo ará ilé. Mr. Faysol, ẹ kúrọ̀lẹ́. Good evening all our viewers and watchers. I greet you all this evening.
Thank you very much. Hope you can see me and hear me clearly from your side, Dema.
Yes, I can see you very clearly. I can hear you loud and clear.
Good. We are good to go. So Like I said earlier, on this program, we discuss topical issues and we converse mostly in English and Yoruba. So I'm going to be sending some questions to you, both in English and Yoruba language. So uh, uh, let me just try to appreciate some people that have joined us right now. But Moss Yunus Achibola, he is watching us from Ghana, and thank you very much for the comment. We really appreciate you so much. And also, he's also giving kudos to us as regards the topic we are discussing today. So, Shitu Tinolaji, thank you very much for watching. We really appreciate you so much. Now, straight to the question, Dr. Epetimehin. How can you describe menopause?
Thank you, Mr. Faysol. Menopause is a medical condition that is characterized by permanent cessation of menses due to natural depletion or reduction of ovarian oocytes from aging. So practically, menopause is said to have occurred when a woman has not seen her period for a period of 12 consecutive months. And this marks a permanent end to fertility in women.
Hmm. Okay. So basically, what menopause is all about is when there is no flow of blood, a monthly flow of blood in women.
Yes, but it has to be for a period of 12 consecutive months, or preferably 1 whole year, that the woman has not seen her period. That is when you say she's already into menopause.
Okay, okay. Now, like what you said now, it's very obvious that when there is no flow of blood for 12 months, basically a year, it's when we can say, okay, a
Yes,
woman has approached menopause. Now, tí
exactly.
èèyàn bá wá ti wá wá mi bá ní kẹ́ tún bá wa ṣe àlàyé yẹn ní èdè Gẹ̀ẹ́sì kó lè yé ní èdè Yorùbá kó lè yé àwọn míì tí wọ́n tún ń wò wá dáadáa tó ń gbọ́ wá.
Ok, tá a bá sọ wípé obìnrin ó ti dé stage of menopause, ìyẹn túmọ̀ sí wípé irú obìnrin bẹ́ẹ̀ kò ṣe nǹkan oṣù mọ́ fún bí odidi oṣù méjìlá léra, àbí yálà ọdún kan léra tí nǹkan oṣù ò wá rárá. Tó bá ti pé ọdún kan tí irú obìnrin bẹ́ẹ̀ tí ò ṣe nǹkan oṣù rárá tí nǹkan oṣù ò wá for a period of 1 whole year, ọdún kan, a sọ wípé irú obìnrin bẹ́ẹ̀ ó ti dé ipò menopause.
Ẹ ṣeun gan ni ẹ jí kíkọ ẹbẹ tó tá bá ní ká wá lọ báyìí àpẹẹrẹ wo lèyìn ó máa rí. You can just give us the signs and symptoms of when a woman is approaching the stage of menopause. Kí làwọn àpẹẹrẹ tí obìnrin máa rí?
Yes, before I move on to the signs and symptoms, I want to briefly tell us that the age range is very important. Usually menopause occurs in women from the age of 40 to the age of 58 years. And we have an average of 51 years of age. So there are so many symptoms that such a woman would experience when they are reaching menopause. We have the medical symptoms and the psychological symptoms. The medical symptoms is that there will be cessation of menses. The menses will not come at all. She will not see her period. And as I said, this is a phase. So seeing not irregular periods means that maybe the person may be having skipped menses, or the menses might be heavy at times. It might be lighter at times. There may be change in the normal duration of the bleeding, or there may be change in the cyclical length of the bleeding. So in short, the sign that one needs to see when such a person reaches menopause is that there will be no menses coming. There will be no flow of menstruation coming at all. And there are some challenges that are, involved in such. We'll come to that later. But shortly, that is the thing that the woman will see, that these menses are stopped coming.
Okay. Thank you very much for that explanation. No, àmọ́ tí a bá ní ká tún wò dókítà wa Epetimehin Olabisi, ẹ ti jẹ́ kó yé wa àwọn ọjọ́ orí tí èèyàn wà, ìyẹn pàápàá jùlọ ìyẹn obìnrin tí obìnrin bá ti wà ní ipò menopause tá a sọ yìí, tí ẹ̀jẹ̀ bímọ, tí ẹ̀jẹ̀ ò bá wá lára obìnrin mọ́, tí ẹ ti jẹ́ kó yé pé àárín ogójì ọdún sí ọdún méjìdínlọ́gọ́ta, ìyẹn 40 to 58 years òun ni. Àmọ́ kí ni àwọn obìnrin míì wà tó ṣe pé wọ́n á mọ̀ tètè ní wípé àwọn ti wọ menopause. Ṣé are there any individual differences to some women when some will say they have approached age of menopause while some are still experiencing this monthly flow of blood?
Yes, there are some women that approach the age of menopause at a rather early stage. We call that early menopause. So women in the age of 30s or in the early 30s, it's possible for them to experience early menopause. But usually this occurs as a result of the fact that maybe they've had surgery, which requires that their ovaries was removed in the past. So if somebody has a cancer, and apart from removing the uterus, they remove the ovaries as well, such a person will not menstruate, such a woman will not menstruate at that early stage when the surgery was done. Apart from that, there is no other reason why a woman should not reach that age, although it's a wide range of age, 40 to 58 years of age. Within that period, different women experience their menopause at different years of their age.
Okay. Ìyẹn túmọ̀ sí pé àwọn nǹkan míì ló ṣeé ṣe kó ṣokùnfà tí obìnrin fi lè má kí àyípadà yẹn kó fi wá lára obìnrin, àbí bẹ́ẹ̀ kọ́?
Bẹ́ẹ̀ni.
So now let's just go straight to the next question. Now, what are the symptoms of menopause? And when I research on something relating to menopause, I got to know something like perimenopause, menopause, and postmenopause. I don't know, maybe you still have that in what you are going to discuss with us. This question, what are the symptoms of?
Okay. If you go to the symptoms of menopause, because menopause is a process, as I said earlier on, and it's in 3 phases. Menopause has 3 phases. We have the perimenopausal phase, which is a stage just before the menopause. Then the postmenopausal phase. The perimenopausal phase is, as I said, is a phase before the menopause, and it can last like maybe by 4 to 10 years. It is officially a stage that ends when women experience 12 consecutive months without the menopause. That is perimenopausal phase. It officially ends when a woman experiences 12 consecutive months without her menses. So after 12 months that the woman has not seen her period, she's said to be in menopause. And then postmenopausal phase also is the after menopause, the period after the menopause. This describes the years of a woman's life after menopause has occurred. Now, having known those 3 phases of menopause, the perimenopausal, the menopausal stage, and the postmenopausal stage, there are some challenges that a woman in that period they can experience. Not all the women will experience all these things I want to talk about, but some of the women will experience the symptoms, in varying degrees. Should I come around to tell us about the symptoms that they are bound to face in that period?
Okay, just go ahead.
Should I go ahead? Yes.
Yeah, you can go ahead.
Yes, I want to group it into 2. Okay, ohun tí mo sọ náà ni wípé tá bá sọ wípé obìnrin ò rí nǹkan oṣù mọ́, kì í ṣe ọjọ́ kan ló máa ń wáyé. Ó jẹ́ wípé nǹkan tó jẹ́ pé a fàágùn fún ọdún mẹ́rin títí bí ọdún mẹ́wàá. A máa ní ìgbà kan tó jẹ́ pé a máa ń pè ní wípé menstruation ó ń parapọ̀, ó ń gbìyànjú láti dáwọ́ dúró. Ìyẹn ni perimenopausal stage. Ìyẹn náà máa ń take a little while. Lẹ́yìn tó bá ti ṣe díẹ̀ bí ọdún díẹ̀, obìnrin bí a wá experience nǹkan tó ń pè ní menopause gangan tí nǹkan oṣù pamọ́ for the past 12 months. Tó bá ti rí bẹ́ẹ̀, then there is another phase which is the postmenopausal phase ó ní àsìkò tó jẹ́ wípé menses ti wá kò tiẹ̀ wá mọ́ rárá. Kí ni àwọn nǹkan tí irú obìnrin bẹ́ẹ̀ máa ní gẹ́gẹ́ bí challenges, gẹ́gẹ́ bí ìrírí? Torí pé ara ti ń yí padà báyìí sìn, ọjọ́ orí ti ń yí padà, nǹkan oṣù tó ń wá lóṣooṣù kò wá lóṣooṣù mọ́. Bára ṣe rí tẹ́lẹ̀ nígbà tí obìnrin ń bímọ, irú ara bẹ́ẹ̀ ò rí bẹ́ẹ̀ mọ́. Kí làwọn nǹkan tó máa ṣẹlẹ̀ sí irú obìnrin bẹ́ẹ̀? Àwọn nǹkan tó máa ṣẹlẹ̀ náà ni wípé tóbìnrin bá ti reach àsìkò tí kò ṣe nǹkan oṣù mọ́, there are so many things, a lot of things will happen to such a woman. And I want to start from the medical conditions. Ohun tó ṣẹlẹ̀ ni wípé there will be cessation. The first thing is cessation of menses. Nǹkan oṣù kò ní wá mọ́ rárá. Oṣù 12, ọdún kan àbọ̀ kò ní wá mọ́ rárá. Èkejì ni wípé irú obìnrin bẹ́ẹ̀, they will be having breast tenderness. They tend to have pain in their breast. Ọyàn á máa ṣe bí ẹni pé ó ń dùn irú obìnrin bẹ́ẹ̀. Ọyàn á máa dùn. Kì í ṣe pé ọyàn tó ń dùn bíi ti cancer kọ́ o, but á máa ní slight pain in the breast. Also, there's something we call hot flushes. Hot flushes means sudden feeling of heat coming from the face to the upper part of the body. This can occur at any time of the day. It can occur during the day, it can occur during the night. It's a sensation of as if you are sitting near the fire and that fire is radiating warmth. Heat is internally generated heat coming from within. And it can be so severe in some women that it will take after 15 minutes for these hot flushes to be occurring. What you must know ni wípé àwọn nǹkan tí èèyàn máa ń rí tí èèyàn bá ti reach menopause, nǹkan oṣù ò ní wá mọ́, ọmọ á máa dùn obìnrin. Àwọn nǹkan tá à ń pè ní ara gbígbóná láti inú ojú wá, á máa dàbí pé ara ń gbóná nínú, ara máa gbóná nínú, á máa jáde síta. Ó lè jẹ́ ara gbígbóná lójú, kókàn dàbí pé heat yẹn wà nínú ojú èèyàn tó ń jáde síta mọ́ upper part of the chest. And it can be so severe in some women. Thank God, because of the skin color that we Africans have, it is not all that prominent, but it's very prominent in the Caucasians. The white women, you will see their faces turning red, the upper part of the chest turning red. Ọlọ́run fún wa ní oore ọ̀fẹ́ àwa tá a wà ní Áfíríkà tá a jẹ́ èèyàn dúdú. Hot flushes tá à ń sọ ìkára máa gbóná síta yìí kò ń ṣe nǹkan tí ó máa ń sábà ṣe rí níta fún obìnrin tó bá jẹ́ obìnrin dúdú. Ṣó ti yé wa bẹ́ẹ̀ yẹn? So, but hot flushes yìí náà, àwọn kankan wà tó jẹ́ pé ó tún máa aggravate ẹ̀, tó máa ń jẹ́ kó pọ̀ sí. Bí irú ẹni tó bá mu ọtí, obìnrin tó bá mu ọtí, obìnrin tó bá jẹ spicy food. Even stress can cause it, and at times, téèyàn bá wọ aṣọ tó bá fún jù, it can cause the hot flushes to occur. So yàtọ̀ sí pé ara ń gbóná láti inú tí àwọn obìnrin tó bá ti reach ipò tán bímọ mọ́ tán máa ń ní, àtúní nǹkan tá a máa ń pè ní increased sweating. Wọ́n á máa làágùn, òógùn yẹn kàn máa wá. It can come during the daytime, even when the weather is cold, they'll be sweating profusely. They'll be sweating profusely. They can sweat during the day, they can be so severe as to wake that woman up from sleep. Wọ́n á máa làágùn lọ, wọ́n á làágùn lọ́sàn-án, wọ́n lè làágùn lóru gbà míì. Òógùn yẹn lè jẹun tó máa jí wọn sílẹ̀ lóru nìyẹn. Òógùn yẹn ló máa jí wọn sílẹ̀ lóru tó jẹ́ wípé wọn ò ní lè sùn. So a lot of them will have poor sleep pattern. They might not be able to sleep at night very well. Apart from this, they also have painful sexual intercourse. And this is expected because of the dry vagina that is associated with women who are menopausal. And that is where the problem in the family comes up. When they have intercourse, they complain of pain because the normal wet vagina in an average adult is being replaced by dryness. So they will have painful sexual intercourse as a result of dryness of the vagina. And it's not only the vagina that is dry, even the skin will be dry, the skin will be itchy, the skin will be thinned out. And there will also be dry eyes and the mouth. Ẹnu gan á máa dry, ẹnu á máa gbẹ, ara á máa gbẹ. Ibi ilé ọmọ á gbẹ fúrú, ẹ̀ṣẹ̀ ibi ilé ọmọ á gbẹ, ìbálòpọ̀ á di nǹkan tó máa jẹ́ nǹkan tó máa ń dunni ohun tó máa ti ń dùn mọ́ni tẹ́lẹ̀ ìbálòpọ̀ á di nǹkan tó máa ń dunni fún obìnrin tó bá wà ní àsìkò tí kò ṣe nǹkan oṣù mọ́. Bẹ́ẹ̀ náà gẹ́gẹ́ ni orí fífọ́, a máa ní orí fífọ́ àbáàdì, wọ́n á máa ní gbogbo ara ríro, gbogbo ọrùn á máa ro wọ́n, ara á máa ro wọ́n. And also there'll be significant reduction in their sex drive. Somebody who has been sexually active before will now be, won't be all that sexually active again. Àwọn tó jẹ́ pé wọ́n ti máa ń fẹ́ ní ìbálòpọ̀ pẹ̀lú ọkùnrin tẹ́lẹ̀ á di wípé kò tiẹ̀ ní fún wọn mọ́, kò ní bá wọn lára mu mọ́ torí wípé àsìkò tí wọ́n ń là kọjá nígbà yẹn ni. Also they tend to experience weight gain. Obìnrin tó bá ti ń dàgbà torí pé kò ṣe nǹkan oṣù mọ́, activity ẹ̀ á ti wà reduced, and if the activity of a woman is reduced and she's eating normally, she's bound to have weight gain. So irú obìnrin bẹ́ẹ̀ wọ́n á máa tóbi sí, wọ́n á máa tóbi sí, and they are also prone to infection, especially from the urinary tract. Ibi tán ti ń tọ̀ á máa dàbí wípé bóyá kòkòrò á fẹ́ máa dúró síbẹ̀. And then also there's increased risk of heart disease and stroke. Torí pé kí ni àwọn hormones tí obìnrin fi ń bímọ tó máa ń dáàbò bo obìnrin láti má ní heart disease, láti má ní stroke, àwọn tá à ń pè ní estrogen àti progesterone ó ti wà reduced as a result of the stage that the woman is in. So a rí pé obìnrin bẹ́ẹ̀ àìsàn ọkàn àti rọlápárọlẹ́sẹ̀ ó máa ń fẹ́ sábà wọ́pọ̀ ní ọ̀dọ̀ wọn. Bẹ́ẹ̀ náà ni egungun tó ti gbó dáadáa tẹ́lẹ̀, they tend to have what we call osteoporosis. Osteoporosis means weak bones. The bones are very brittle. They are no more as strong as when they were. Bẹ́ẹ̀ ni bó ṣe wà tẹ́lẹ̀ mọ́, tó jẹ́ pé irú obìnrin bẹ́ẹ̀ tó bá tiẹ̀ ń lọ lẹ́nu staircase tó bá rọra miss step, ó ṣeé ṣe kí egungun dá. Torí pé egungun ti di tọmọdé padà, ó ti soft, ó ti di tọmọdé padà. Torí nǹkan tó yẹ kó jẹ́ kí egungun yẹn kó dúró dáadáa, ó ti ń kúrò as a result of menopause. So these are so many things that happens to women that are menopausal. As I said earlier on, it's not all the women that will experience all this, and it is not in severity. The severity also varies. There are some women tó jẹ́ wípé wọn ò tiẹ̀ ní sign kankan, gbogbo tá à ń pè ní hot flushes ó lè wà ń bẹ̀, but ó lè má pọ̀. Tá à ń pè ní UTI ẹlòmíì lè má ní, tá à ń pè ní breast tenderness ẹlòmíì lè má feel it because our bodies are different. So kì í ṣe pé gbogbo nǹkan tí mo sọ as this medical conditions náà ló máa ṣẹlẹ̀. And apart from the medical condition, we also have the psychological challenges tí irú àwọn obìnrin bẹ́ẹ̀ máa face. And what do I mean by that? Apart from the medical, tá a mọ̀ wípé hormones yẹn ló ń ṣe, psychologically too, women in their menopause are bound to have certain psychological problems, ranging from lack of motivation. They will not be motivated to do anything. They might also have mood swing. Irú obìnrin bẹ́ẹ̀ wọ́n lè máa inú lè máa bí wọn jù, wọ́n máa bínú ṣẹ́kẹ́ṣẹ́kẹ́, kán wà aggressive, wọ́n máa jà, wọ́n máa bínú ṣẹ́kẹ́ṣẹ́kẹ́, wọ́n máa jà. They lose interest in normally pleasurable things. Àwọn kan tó yẹ pé ó ti máa ń wù wọ́n ṣe tẹ́lẹ̀ kan ṣe, wọ́n lè lose interest, wọ́n má lè fẹ́ ṣe mọ́. And if care is not taken, they might be depressed as well. And that is the end stage of this psychological problem. They can go into depression that may need them to check and see the doctor for appropriate treatment.
Okay. Well, thank you very much for that explanation. We really appreciate you so much. So, ladies and gentlemen, you're still watching Faysol Oluwakemi Health Show live on Facebook, and today we are focusing on menopause and its challenges, menopause transition and its challenges. You know, the stage between stage of having menstrual cycle and stuff like that, the transition into a menopausal stage. Those are the things we are discussing today on this week's episode of Faysol Oluwakemi Health Show. And on the program today, we've been having our guest, Dr. Epetimehin Olabisi Oyetola. She is a general practitioner, general medical practitioner working with Oyo State government, and she is the chief medical officer at Secretariat Staff Clinic, or just the Secretariat Staff Clinic. So as you can see, we are featuring somebody that has the knowledge about what we are discussing. And aside that, I personally choose her to give us that topic because of her age. She might have passed through that stage of menopause and what we are discussing today. So, ẹyẹ wálé ètò Faysol Oluwakemi Health show náà ó lẹ̀ ń gbọ́ tẹ̀ ń gbádùn látàárọ̀, a sì ń ṣe àgbéyẹ̀wò nǹkan kan tó tún ṣe kókó tó ṣe pàtàkì fún àwọn tó jẹ́ obìnrin nílé. Òun náà ni n tá à ń pè ní menopause, àkókò tó máa ń wà nínú ìgbé ayé obìnrin tí a máa fi ń sọ pé obìnrin o wọn lè ráyè bímọ ṣe nǹkan báyìí báyìí, tí ọ̀pọ̀lọpọ̀ á mọ̀ pé tóbìnrin bá dé abala yẹn o wọn kì í ní àǹfààní láti bímọ tàbí lóyún mọ́, àti pé àwọn ìpèníjà tí ó máa ń ṣẹlẹ̀ sí àwọn obìnrin lákòókò yìí, àwọn nǹkan tí à ń gbé yẹ̀wò náà nìyẹn. Ṣé ẹ gbàgbé pé bẹ́ẹ̀ ṣe ń wò wá yẹn, ẹ gbìyànjú láti máa bá wa share fídíò yẹn. You can please share this video as you are watching us live. Create a watch party with it so that this topic can reach a large number of people. So don't forget, you can also ask questions as the program is going on live. And as well, you can call live on the show to ask questions from our guests. So the number to call is on the screen right now, and that is 070 83606280. So if you are calling from outside the country, you can just please add +234 070 83606280. Now, màá gbìyànjú láti àwọn ìbéèrè kan wà níbí tí àwọn èèyàn ti ń fi táwọn èèyàn ń wò wá tó dẹ̀ ń béèrè bí ó ṣe wà níbí. Kó tó dìgbà yẹn, ẹ jẹ́ n kọ́kọ́. Thank you very much. You're watching us live from Akobo. We really appreciate you for watching us right now. Thank you very much from Akobo. So Duro will just say that right. So Adeniyi Abimbola Mushrafa, thank you very much for watching. We don't know where you're watching us from, but thank you very much for the comments. We really appreciate you. Koinde Akim Adegoke, thank you very much, Mr. Akim Adegoke. I guess you are watching us live from Gombe State, if I'm not mistaken. So this is another question from one of our viewers. So the person said, what remedy used in order to increase the hormone for the sex drive after being menopausal? I think it's a good question that you need to note, maybe when it's time to answer that. So also, thank you very much for the compliment, Kabira Temi. Thank you very much. So, bóyá ká tiẹ̀ bẹ̀rẹ̀ lórí ìbéèrè tí ẹni ìbéèrè pé kí ni àwọn nǹkan téèyàn lè lò láti jẹ́ kí jíjẹ́ ṣíṣe ta kébékébé fún ìbálòpọ̀ tí obìnrin bá ti wọ ìpele tá à ń sọ menopausal stage.
Thank you very much. The person that asked that question is a very good question because I was expecting it too. Because
sorry, there is another question. Maybe if you can just take it all together. Àwọn ìbéèrè míì tún wá tó tún fara pẹ́ yẹn. Ẹni ní Badmus Yunus Ajibola from Ghana. He said, can surgery? You can see the question. Bó ṣe wà lórí screen, ma.
Yes.
Can surgery during birth cause early menopause? So okay. Another question from him.
Yes, if I should take the first question, should I go ahead? Surgery during birth, when giving birth, when you want to give birth, and that woman happens to undergo cesarean section by surgery, it is not likely to cause menopause. It is not likely to cause menopause. The surgery I'm talking about is surgery that occurs maybe as a result of cancer in the patient, and in other, or maybe there's disease in the ovary. We call that the name of the surgery oophorectomy, because all these hormones that causes bleeding occurs in the ovary. So if the ovary, for any reason, by cancer or disease, is removed, then such a woman will go into menopause. Ohun tí mo sọ náà ni wípé menopause yìí ohun tó lè fà á tí èèyàn bá bímọ tán ṣiṣẹ́ ọmọ tán ṣiṣẹ́ abẹ fúngbà tó fẹ́ bímọ kò likely kò ṣeé ṣe kó fa wípé kéèyàn dẹ̀ má rí nǹkan oṣù mọ́ tí wọ́n bá ṣe níbi tán ti máa ń ṣe iṣẹ́ abẹ dáradára tí dókítà tó mọ̀ye tó ṣe. Ohun tó lè fa kí obìnrin má rí nǹkan oṣù mọ́ kó tó di wípé ó dé ọjọ́ orí yẹn ni wípé tó bá ní àrùn níbi ẹyin ilé ọmọ yẹn ló máa ń produce àwọn hormones tá à ń sọ estrogen àti progesterone. Tó bá ní àrùn tó bá jẹ́ wípé wọ́n wá ṣe iṣẹ́ abẹ fún tán yọ àpò ilé ẹyin ọmọ yẹn kúrò, we call it oophorectomy. Tán bá yọ méjèèjì kúrò ẹni pé nǹkan tó ń produce pé kéèyàn ṣe nǹkan oṣù wọ́n ti yọ kúrò, so irú obìnrin bẹ́ẹ̀ kò ní ṣe nǹkan oṣù mọ́ rárá. Now talking about the second question that say
hello, are you there? So I guess we're having a network issue from the end of our guest. So I guess the connection is trying to connect. So once we are connected with him, we will be able to link up with our guest at the moment soon, due to the network issue. So you are still watching Faysol Oluwakemi Health Show live on Facebook, and today we are focusing on menopause, menopausal transition, menopause transition, and its challenges. Àwọn nǹkan tá à ń gbé yẹ̀wò náà nìyẹn. Tí àlejò wa tí connection yẹn tó bá di ṣe dáadáa, a máa láǹfààní láti tún máa gbọ́ nípa àwọn àlàyé kọ̀ọ̀kan èyí tí wọ́n ṣe fún wa. So you can go ahead with what you are saying, ma, Dr. Epetimehin.
Yes, sir. Now I'm trying to answer the question, the very first question that asks about remedies that can be given to women who are having problems with sexual intercourse as a result of the dryness of the vagina. There are so many preparations that has been made for such women. What happens that makes intercourse very difficult for them is because of the dryness of the vagina. So there are so many lubricants that they can use to moisturize the vagina and make sexual intercourse enjoyable. Ohun tí mo sọ náà ni pé àwọn oríṣiríṣi oògùn ti wà táwọn obìnrin lè lò láti fi lè mú kí ìbálòpọ̀ kó má jẹun tí ó di alágbára fún wọn. Preparation bẹ́ẹ̀ yẹn wà tó yẹ pé bíi lubricants ní bíi oil ní báyìí tí wọ́n lè máa lò to lubricate. Also because of the low amount of estrogen, òun ló máa ń cause kí vagina yẹn wà very dry. So there is a preparation for them. The estrogen preparation, vaginal estrogen preparation is also available for them to use. But such estrogen preparation will be used with caution because estrogen, when it is administered, have a risk of causing cancer in women who are at risk. Ohun tí mo sọ náà ni pé àwọn preparation kan wà tí wọ́n lè lò fún àwọn obìnrin bẹ́ẹ̀. A máa ń pè wọ́n ní estrogen preparation àbí estrogen and progesterone preparation tó ti wà láti lò fún àwọn obìnrin bẹ́ẹ̀. But a gbọ́dọ̀ weigh benefits pẹ̀lú nǹkan tá a fẹ́ kó ṣẹlẹ̀ sí.
Àǹfààní ẹ̀
fún àwọn obìnrin tí wọ́n lè ní nǹkan ìbálòpọ̀ dáadáa pẹ̀lú ọkọ wọn. Tó bá lo nǹkan bẹ́ẹ̀ yẹn fún wọn lọ́jọ́ iwájú ó lè fa cancer of the breast or cancer of the endometrium. So kì í fẹ́ lo irú àwọn hormonal preparation yẹn fún wọn.
Torí ewu tó rọ̀ mọ́.
Ewu tó rọ̀ mọ́ ó ṣe pàtàkì ó dẹ̀ lágbára ju àǹfààní tí wọ́n fẹ́ rí nínú ẹ̀ lọ.
Ẹ ṣeun gan ni. So ẹ jẹ́ kí a máa tẹ̀síwájú pẹ̀lú àwọn nǹkan báyìí. There is this argument nípa wípé ọ̀pọ̀lọpọ̀ àwọn obìnrin kan wà tó ṣe kí wọ́n di kọjá 60 ọdún. We have some in the news that a woman of over 60 years old gave birth. Ike obimo. Kibo lati shele say, what is your take on that? So is that really possible? If you don't have menstruation, you can't even get pregnant, not to talk of giving birth. So kininti ale songpa.
Sherry, in medicine, we don't say never. There's nothing like never in medicine. Nínú ètò ìmọ̀ ìṣègùn olóyìnbó a gbọ́dọ̀ sọ pé kò lè ṣẹlẹ̀ láéláé torí pé kò sí nǹkan tó lè ṣẹlẹ̀. fúnra àwọn obìnrin tó jẹ́ wípé in their 60s 62 tá à ń gbọ́ recently pé wọ́n bímọ yẹn, ohun tó ṣẹlẹ̀ náà ni pé nǹkan bákan méjì ni, because the news will not carry the way they got that baby. Ó possible kó jẹ́ wípé wọn ì tí really get to the age of menopause, wọ́n ṣì wà ní perimenopausal stage, so nǹkan oṣù wọ́n ṣì ń ṣe ségesège, kò tí ì dúró pátápátá. Tó bá ti di pé nǹkan oṣù ò tí ì dúró pátápátá, there is a possibility for them to have egg being released from the ovary. So it is that period that the egg was suddenly released from the ovary that gets to the uterus. Ìyẹn ló fa kí wọ́n ní ìbálòpọ̀ tí wọ́n dẹ̀ fi bímọ. Àwọn obìnrin míì wà tó jẹ́ wípé àwọn obìnrin míì wà tó jẹ́ wípé àwọn obìnrin tán jẹ́ òpépé tán jẹ́ ọlọ́mọge náà máa ń donate egg fún wọn. Wọ́n á donate egg fún obìnrin bẹ́ẹ̀, wọ́n á implant egg yẹn sínú uterus obìnrin yẹn, wọ́n á dẹ̀ fertilize ẹ̀. Yẹn la máa ń pè ní ọmọ bíbí òde òní. Ṣàgbé tẹ́lẹ̀tẹ́lẹ̀ àwọn obìnrin, a sọ pé àwọn obìnrin kan wọn ò lè bímọ mọ́ torí pé kinní, but ní ìsìn kò rí bẹ́ẹ̀ mọ́. Àti ní artificial insemination tó jẹ́ pé tóbìnrin bá tẹ̀ tí ò ṣe nǹkan oṣù mọ́, a lè gba ẹyin láti obìnrin tó bá jẹ́ ọmọge, ká fi ẹyin yẹn sínú obìnrin tó jẹ́ àgbàlagbà yẹn, kí fertilization dẹ̀ take place, wọ́n dẹ̀ bí ọmọ. Tí ohun tí mo sọ yìí
ẹ ṣeun gan ni. Ẹ̀yin yẹn wálé ètò tí ẹ ń gbìyànjú láti gbọ́ tá a dẹ̀ ń gbìyànjú láti sọ fún yín náà ni lórí ètò náà ni àwọn nǹkan tó jẹ́ ìpèníjà tí obìnrin máa ń rí tó bá ti ń wọ àkókò, ìyẹn àkókò tí kò ní sí ṣíṣe nǹkan oṣù mọ́ lára obìnrin, ìyẹn tá a mọ̀ sí menopause. Bẹ́ẹ̀ dẹ̀ ṣe ń wò wá yìí, ẹ láǹfààní láti béèrè gbogbo nǹkan tí ẹ bá nífẹ̀ẹ́ láti béèrè, tẹ́ bá fẹ́ béèrè nípa nǹkan tí a gbéyẹ̀wò lórí ètò yìí, yálà kẹ́ pè wá ní sórí ètò bó ṣe ń lọ báyìí tí àbí kẹ́ fi àtẹ̀jíṣẹ́ ránṣẹ́ as comment. So as you are watching us right now, you have the opportunity to call us live on the program and ask anything you need to ask about our topic of discourse for today. Better still, you can still drop a comment and ask your question from our guest as regards what we are discussing. So we've been discussing on menopause, transition and its challenges. That is our topic for today. And our guest on the show is Dr. Epetimehin Olabisi Oyetola, Chief Medical Officer at Secretariat Staff Clinic, Ibadan. So, we have discussed so far on this topic. We've discussed on what menopause is all about, the stages of menopause and the challenges, and also the symptoms, some major symptoms we are likely to see when it comes to menopause stage. So now, Dr. Epetimehin, nǹkan kan wà tí mo tún fẹ́ béèrè. Tí èèyàn bá ti wà ní ipò báyìí gẹ́gẹ́ bí obìnrin, kí ni àwọn nǹkan tó yẹ kí obìnrin ó máa ṣe? Àti wípé gan kó tó di pé bá mi dáhùn yẹn, ṣé téèyàn bá di wọ menopause, èèyàn gbọ́dọ̀ ní ìbálòpọ̀ kankan mọ́ pẹ̀lú ọkùnrin ni?
Ẹ ṣé kí n dáhùn ìtẹ́ fi ṣe ìkejì yẹn, kí n kọ́kọ́ dáhùn ẹ̀, torí wípé ọ̀pọ̀lọpọ̀ àwọn èèyàn ló máa ń béèrè irú ìbéèrè bẹ́ẹ̀. Ṣé rí, tí obìnrin bá ti dé ipò menopause, kò túmọ̀ sí wípé òun àti ọkọ ẹ̀ kan má ríra mọ́, kò túmọ̀ sí rárá. Ọ̀pọ̀lọpọ̀ misconception àbí myth làwọn èèyàn míì máa ń sọ. Ẹlòmíà ní táwọn bá ti reach menopause o, tọkọ àwọn bá rí àwọn o, ikùn àwọn á máa wú o, ẹ̀kẹ́ àwọn á máa wú o. Kò sí nǹkan tó jọ bẹ́ẹ̀ medically. Medicine kò fi díẹ̀ múlẹ̀ wípé once tóbìnrin bá ti bẹ̀rẹ̀ sí ní di pé kò ṣe nǹkan oṣù mọ́, kò gbọdọ̀ rí ọkọ ẹ̀ mọ́. Ohun tó túmọ̀ sí ni wípé tó bá ti di wípé kò rí nǹkan oṣù mọ́, the possibility of getting pregnant is very, very much reduced. So pé obìnrin ò ní máa rí ọkọ ẹ̀ láti máa ní ìbálòpọ̀, kò ṣe ohun tó tọ́, kò dẹ̀ ṣe ohun tó yẹ, pàápàá jùlọ ní ìdílé tó bá jẹ́ wípé oníyàwó kan ọkọ kan ni. Kò ṣe ohun tó yẹ kó rí bẹ́ẹ̀, torí pé kò sí nǹkan tó jọ wípé ikùn ń wú, ẹ̀kẹ́ ń wú, rárá o. Ìmọ̀ ìṣègùn kò fi díẹ̀ múlẹ̀. Ìkejì tẹ́ béèrè star nípa nǹkan tó yẹ kí obìnrin tó bá ti reach menopause kó máa ṣe, mo ti ká gbogbo nǹkan tó máa ń ṣẹlẹ̀ sí wọn. Ṣẹ́ni tóbìnrin bá ti reach menopause, that is the time for that woman to be taking very balanced diet. Tí ó bá ti ń jẹ́ ẹni tó ń jẹ oúnjẹ tó péye tẹ́lẹ̀, ó gbọ́dọ̀ máa jẹ oúnjẹ tó ń ṣara lóore. Kó jẹun láàárọ̀, kó jẹun lọ́sàn-án, kó jẹun lálẹ́. Oúnjẹ tó ń ṣara lóore, ó nílò ẹ̀ púpọ̀. Irú obìnrin bẹ́ẹ̀, because of the process of aging, wọ́n gbọ́dọ̀ máa mu omi tó pọ̀ dáadáa. I said earlier on wípé skin wọn máa dry, ojú wọn máa dry, ẹ̀kẹ́ wọn máa dry, ara máa dry because of loss of collagen. So irú obìnrin bẹ́ẹ̀ gbọ́dọ̀ máa mu omi tó pọ̀, about 3.7 liters of fluid kan máa mú in a day. Because apart from the fact that the body needs water, all the organs of the body that is already aging, they need water. Apart from that, exercise is another thing. Irú obìnrin bẹ́ẹ̀ kò ní jẹ́ tó jókòó sójú kan wípé mo dẹ̀ ti dàgbà báyìí o, ẹ jẹ́ wá jókòó sójú kan. Such a woman must from time to time be exercising, not vigorous one. Even walking from one street to another is a form of exercise. It is not the time for such a person or such a woman to now sit down. There's tendency to there's tendency to add weight. That is not the time for you to now sit down. It's time for you to get up and be up and doing. So all these things, and for such women, because their skin tends to sag as a result of aging, we advise them to use moisturizers. That is not the period for such a woman to be using cream to bleach the body or anything like that. No.
I think you have a call. Hello.
Hello, good evening, sir.
Yes. Hello, good evening.
Please, I want to ask a question on your program.
Sorry, your name and where you're calling us from?
My name is Inu. I'm calling from Ibadan.
You are calling from where?
Ibadan.
From Ibadan. Please go ahead with your question, please.
The question I want to ask is it possible that maybe inhaling some food can affect a menstrual cycle?
Okay. Can
it affect maybe something that is highly
toxic?
Strong? Yes. Can it affect menstrual cycle?
Okay. Do you hear the question, ma? Alejoa?
Yes, I heard very well. Madam that is calling, it is not possible for smell, or maybe you smell something very toxic or very foul smelling. It has no relationship with your cycle. Absolutely not. It doesn't have anything to do with your cycle.
Hello?
If you smell anything and it's unpleasant, hello, I'm listening. If you smell anything and it's unpleasant, all you need to is to move away from what you are smelling that is not pleasant to where we take fresh air. It doesn't have anything to do with your menstrual cycle. It has absolutely not. The menstrual cycle is controlled by the ovary, the hormones in the ovary, which are estrogen and progesterone.
Okay. So I think that answers that. What Tinola caller, the first caller on this program. So this another question coming from a man. He said, what is the effect of sperm release? Menopause, Badmos, Sajibola from Ghana.
Okay, Mr. Yunus Sajibola from Ghana. The sperm of a man, it doesn't have any adverse effect on the woman that is already menopausal. If the woman has been confirmed to be menopausal, that is, she has not seen her period for 12 consecutive months, what it just means is that the sperm will go in, and if there is no ovary to fertilize, no ovum to get fertilized, the sperm will be destroyed there, because the sperm doesn't stay there forever. It stays there looking for the ovum to fertilize. And if there is no release of egg into that place for fertilization to take place, the sperm is going to die, because already the woman that is menopausal is already sterile. She is not likely to be pregnant anymore. So releasing sperm into her doesn't mean anything. It doesn't mean anything. It's not going to affect her in any way. I just answered the question. It's not going to affect her in any way. It's not going to make her tummy to be big. All these are myths that don't have any medical foundation. All right? So I think I've answered your question.
So okay, what yes, that answers it. What you just made Yeah, what you just made mention now about myth and misconception about menopause. Àwọn nǹkan yẹn, àwọn àṣìgbọ́ táwọn èèyàn máa ń ní nípa menopause yẹn mo tẹ̀ fẹ́ pé kẹ́ ẹ tún bá wa ṣàlàyé ẹ̀. Kí làwọn àṣìgbọ́ táwọn èèyàn máa ń ní tó bá dọ̀rọ̀ wípé èèyàn tí obìnrin ò lè ṣe nǹkan oṣù mọ́ ti wà ní ipò menopause?
Ẹ ṣe sá, oríṣiríṣi nǹkan la máa ń gbọ́ pàápàá jùlọ nílé ìwòsàn tí wọ́n máa fi tó wa létí àwọn obìnrin bẹ́ẹ̀ wípé àwọn ò jẹ́ kọ́kọ́ àwọn fọwọ́ kàn wọ́n mọ́ o, torí pé wọ́n sọ wípé táwọn bá ti reach menopause o, táwọn bá ṣe ń rí ọkọ àwọn, inú àwọn lè máa wú, ẹsẹ̀ àwọn lè máa wú, ẹ̀kẹ́ àwọn lè máa wú, ó tiẹ̀ lè fa káwọn kú láìpẹ́ ọjọ́. All these things, they don't have any medical foundation. They are myths. They are just things that are used to scare women in the olden days, when medical knowledge is not that, extended to people. But these days, it is all lies. How come? Is it possible for sexual intercourse that has been successfully done by women to give birth now become something that is dangerous to them? There are myths and misconceptions that have no foundation at all. Yeah.
Wọ́n ní tó ń gbádùn tó ń ṣe ọ̀ṣù tẹ́lẹ̀ wọ́n á láwọn ò gbádùn.
Bẹ́ẹ̀ ni kò dẹ̀ sí nǹkan tí ò jẹ́ kán gbádùn ẹ̀mọ́ náà ní gbogbo nǹkan tí mo ti ṣàlàyé fún yín pé the sexual drive has been so much reduced as a result of aging. The vagina that used to be moist and properly wet before has become very dry, which we all have solutions to. Because of aging, they become disinterested in things like that, which should not be so. It should not be so. It's a phase in life. It's a phase in life. Whatever has a beginning will surely have an end. That was the time that the woman was not menstruating before, when it was at puberty and was just starting to develop the sexual characteristics that eventually led to menstruation. So there will also be another stage when the menstruation is packing to go back to where it came from. So all these things are natural things that the body has to experience. All the women will have to experience menopause, whether they like it or not. It is a natural process that takes place in every woman as their age.
Ẹ ṣeun gan ni àlejò. Ẹ̀yin wálé, ètò tẹ́ ń gbọ́, ètò yín tẹ́ nífẹ̀ẹ́ sí náà ni ètò ìlera, èyí tí Faysol Oluwakemi tó gbé kalẹ̀ tá a pè ní Faysol Oluwakemi Health Shows. Gẹ́gẹ́ bí ìṣe wa ẹdí mọ̀ wípé ohun tó bá ní ṣe pẹ̀lú ìlera wa, òun náà la máa ń gbé yẹ̀wò lórí ètò yìí. Bákan náà ló ṣe rí lénìí lágbára Ọlọ́run, tó sì jẹ́ pé nǹkan tí à ń gbìyànjú láti gbé yẹ̀wò lénìí, òun náà ni nǹkan tó ní ṣe pẹ̀lú àwọn obìnrin. Ẹ láǹfààní láti pè wọlé níwọ̀nba àkókò tí a sì ní, tàbí kẹ́ ẹ fi àtẹ̀jíṣẹ́ yẹn sọwọ́ láti béèrè ìbéèrè lọ́wọ́ àlejò wa lórí nǹkan tí à ń gbìyànjú láti gbé yẹ̀wò lórí ètò náà. You've been watching Faysol Oluwakemi Health Show, and today we are discussing on menopause transition and its challenges. So on the show, we've been having Dr. Epetimehin Olabisi, who she has been discussing so far on what this topic is all about and different questions asked by our viewers. So really appreciate our first caller on the show. I think this person needs to be awarded for being the first caller on the program. Mrs. or Miss Oyetola, if you're watching, I really appreciate you. So we surely get back to you and recognize you for being the first caller on this program. So we have another question. If you have another question, we still have like 5 to 10 minutes on the show before we call it a wrap today. Kó tó di pa máa parí ètò, a sì ní iye ìṣẹ́jú bíi mélòó kan láti fi dáhùn ìbéèrè lọ́lọ́kan-ò-jọ̀kan èyí tí ẹ̀yin èèyàn wa bá fẹ́ béèrè lọ́wọ́ àlejò wa kó tó di pé a máa lọ. Ẹ láǹfààní láti pè sórí ẹ̀rọ ìbánisọ̀rọ̀ tí ẹ̀ ń wò níwájú yín yìí, tàbí kẹ́ fi àtẹ̀jíṣẹ́ àti etí ìgbọ́ àwọn èèyàn. Ìbéèrè kan leléyìí, èyí tí ó wá látọ̀dọ̀ ọkùnrin náà ló ń tọ̀. Mi ò mọ̀ bóyá àlejò wa. I don't know if you can see the question on your screen from one of our viewers right now. Ẹni yẹn béèrè wípé for men of
Yes, I
and
think
side
I can
effects.
see the question. Yes. The question says, for men of old age, we learn sex causes weakness and side effects. Conclusively, should old women rather stay away from sex at old age, beneficial or not? I wouldn't say the old women should stay away from sex. Pé bẹ́ẹ̀ ni àwọn àgbàlagbà wọ́n sọ pé àwọn ọkùnrin tán bá ti ń dàgbà pé ṣé wọ́n gbọ́dọ̀ máa ní ìbálòpọ̀ mọ́ pẹ̀lú àwọn obìnrin tó bá ń dàgbà. Eléyìí ò yẹ kó rí bẹ́ẹ̀. Ìgbà kan ni àwa tá a jẹ́ obìnrin àti àwọn tó jẹ́ ọkùnrin bá lé wa tá a wà lópèpé, and as we are aging, àwọn ń dàgbà àwa náà ń dàgbà ni. Kì í ṣe pé bóyá obìnrin ń dàgbà ọkùnrin ò dàgbà, ọkùnrin ń dàgbà obìnrin ń dàgbà. So obìnrin tó bá dàgbà tẹ́ pé inú ilé ọkọ ẹ̀ náà ló ti ń dàgbà, ọkọ tó dẹ̀ fẹ́ náà jíjọ ń dàgbà, kò sí tó ní kí àwọn méjèèjì kan má máa rí ara wọn gẹ́gẹ́ bí lọ́kọláya. Ìbálòpọ̀ ó lè má dàbí tàtijọ́, ó lè má gúnná mọ́ bí tàtijọ́, ṣùgbọ́n ìbálòpọ̀ lẹ́ẹ̀kọ̀ọ̀kan kò sí tó fi ń ṣe ara, kò sáìsàn kankan tó ń kó bá ara, kò dẹ̀ fa ikú òjijì, kì í fa àìsàn sí ara, yálà ti ọkọ ni àbí ti obìnrin ni, ó fa àìsàn sínú àgọ́ ara kankan. Ìbálòpọ̀ lọ́jọ́ àgbàlagbà tí a bá ti dàgbà kò ṣe ohun tó máa ń ṣe kíákíá, lẹ́sẹ̀ tó jẹ́ wípé wọ́n máa ń ṣe bí ìgbà tán wà léwe. Bọ̀ lẹ́ẹ̀kọ̀ọ̀kan ara ò gbọdọ̀ máa sá fára, ọkùnrin ò gbọdọ̀ sá fún ìyàwó ẹ̀ tó jẹ́ àgbàlagbà, obìnrin ìyàwó tó jẹ́ àgbàlagbà náà ò gbọdọ̀ sá fún ọkọ ẹ̀ tó jẹ́ àgbàlagbà. Understanding òun ló matter jù nínú ìbálòpọ̀ tá a bá ti di pé a ti di àgbà, yálà ọkùnrin tàbí obìnrin.
Àgbọ́yé yẹn gangan ni ó ṣe kókó, ló ṣe pàtàkì jù, àbí bẹ́ẹ̀ kọ́?
Bẹ́ẹ̀ ni, àgbọ́yé ló ṣe pàtàkì.
Kó tó di wípé a máa lọ, àmọ̀ràn wo lẹ́ni fún àwọn obìnrin tó ń gbọ́ wa báyìí lórí nǹkan tí a gbé yẹ̀wò lórí ètò fún tòní?
Fún àwọn obìnrin ẹlẹ́gbẹ́ mi tó ń gbọ́ wa, tó ń gbé ètò yìí láti bí odidi wákàtí kan, mo fẹ́ sọ fún wa wípé ṣẹ́rí kan tá à ń pè ní menopause, àti pé kí obìnrin kó má ṣe nǹkan oṣù mọ́, ohun tó jẹ́ pé natural, ohun tó máa ń ṣẹlẹ̀ sí gbogbo obìnrin, tó jẹ́ nǹkan tó natural pẹ̀lú obìnrin ni. So kì í ṣe nǹkan tó jẹ́ wípé ó jẹ́ àìsàn, kì í sì ṣe nǹkan tó jẹ́ wípé a gbọ́dọ̀ rí pé eléyìí rí. Ohun tí mo sọ ni pé understanding ló matter jù. The husband should understand the wife wípé àsìkò yìí o àsìkò tó léwu ni, àsìkò yìí o àsìkò tó lẹ́gẹ́ ni, àsìkò tí ìyàwó mi ń là kọjá yìí, àsìkò tó yẹ pé òun gan fúnra ara ẹ̀ kì í ṣe pé fọwọ́ fà, ṣùgbọ́n nǹkan tó jẹ́ wípé ara àti àwọn èròjà ara tá à ń pè ní hormones ló fà fún. Bó bá dẹ̀ ṣe rí bẹ́ẹ̀, tóbìnrin bá ti ń pẹ́ tó ti di pé menopause yẹn ti ń gbé ọ̀pọ̀lọpọ̀ ọdún, àwọn nǹkan tí mo ṣàlàyé ṣáájú gẹ́gẹ́ bí gbogbo àwọn wàhálà tó máa ń so mọ́ menopause á máa kúrò bẹ́ẹ̀ díẹ̀díẹ̀. Mo rọ àwọn baálé wa nínú ilé ká fa àwọn ìyàwó wa mọ́ra tán bá ti ń dàgbà, tó bá ti di wípé wọ́n ti ní irú àwọn wàhálà díẹ̀díẹ̀ tí àìmáa ṣe nǹkan oṣù tó máa ń fà lọ́wọ́, ká fà wọ́n mọ́ra. Àwa tá a jẹ́ ọmọ wọn ká fà wọ́n mọ́ra. Àsìkò ni ó wá ni, tó bá dẹ̀ ṣe díẹ̀ ó máa ṣe kíni, ó máa bá tiẹ̀ lọ. So kì í ṣe nǹkan tí ó jẹ́ pé ojú òrìrí àbí àìsàn.
Ẹ ṣeun gan ni. Àlejò wa, on a lighter mode now, ìbálòpọ̀ ní àsìkò tí èèyàn ti wọ menopause, àsìkò ìgbà téèyàn wà menopause, èwo ni máa ń dùn jù?
Nǹkan ńlá lẹ béèrè lọ́wọ́ mi yẹn o. Àìmọ̀dẹ̀ mọ̀ pé Mr. Faysol lẹ́yìn náà mọ ẹni tí mo ánsà ẹ kàn fẹ́ fà mí lẹ́sẹ̀ ni, ẹ ti mọ ánsà. Lè fìgbà tá a wà ní èwe, ẹ ṣe Mr. Faysol olóòtú, àsìkò téèyàn bá wà ní èwe, ṣe pórí tá a fi ṣèwé náà rè àti ìyípadà. Ìgbà téèyàn wà ní èwe, gbogbo alámọ̀ pé èèyàn máa ń ṣe bí èwe ni, ṣùgbọ́n tágbàlagbà bá dẹ̀ ti dé, ó ti di wípé ká ṣe kíni, ká tẹ̀ jẹ́jẹ́. So okun ọmọdé a lè fi wé okun àgbà. Okun ọmọdé a lè fi wé okun àgbà. Kí lẹ wí sà? Jẹ́jẹ́ léegun àgbà máa jó. Bẹ́ẹ̀ ni, jẹ́jẹ́ ni. Jẹ́jẹ́ léegun àgbà gbọ́dọ̀ máa jó.
Ẹ ṣeun gan ni. Kó tó di pé máa lọ, before you leave on the program for today, both in English and in Yoruba language, what can you say about Faysol Oluwakemi Health Show, this show per se, and all other Faysol Oluwakemi Health shows?
Thank you very much, Mr. Faysol Oluwakemi. I think your health show is very, very educative. and very nice. I so much love it. I watched the one earlier that was done about a week ago, and I think the populace are they are all benefiting from it, because you are bringing healthcare, understanding of healthcare into the grassroots, so people are able to know their health challenges. They're able to know a lot of things about health, and they're able to contribute their own portion. And also, the myths and the misconceptions are being, thrashed out. It is a very, very, very interesting and good project. And I pray that you continue bringing sensitive topics like this to people, for people to hear. It is a wonderful job. Keep the flag flying. We are enjoying you.
Àlejò wa, ó dàbí pé ìgbà tí ẹ ń sọ̀rọ̀ lẹ́ẹ̀kan kíní ọ̀hún ó ṣe bákan, bóyá kẹ́ ẹ tún bá wa tún ọ̀rọ̀ yẹn mú dáadáa. The network was somehow messy when you were about.
Okay, ohun tí mo sọ náà ni wípé Faysol Oluwakemi Health Show is a very interesting show. It's an educative show. It's a show that comes straight to the grassroots. It allows people to ask questions. It allows people to know what is happening in their environment, especially concerning their health. And it's a very interesting show that people love to watch. Keep the good work going. The Lord is on your side. I love it as a person, and I think people who are listening to us, who are watching us, who are asking good questions, are also loving the show. The Lord will continue to be with you. The sky is the limit for you. Well done. Lédè Yorùbá tí mo sọ náà ni pé Faysol Oluwakemi show tá a máa ń gbọ́ ní every Saturday evening yìí, àwọn show tó dára ni, àwọn àgbékalẹ̀ tó dára ni, àwọn tó ń bá wa sọ àwọn nǹkan tó ṣe kókó, tó ṣe pàtàkì, àwọn nǹkan tó yẹ ká mọ̀ lágọ̀ọ́ ara wa ní ohun tó ń ṣẹlẹ̀, pàápàá jùlọ àjàkálẹ̀ àrùn tó ń ṣẹlẹ̀ àti gbogbo ohun tó yẹ ká mọ̀ gẹ́gẹ́ bí ènìyàn ni wọ́n fi ń tó wa létí. Táwọn èèyàn tí wọ́n jẹ́ pé wọ́n ní orí ọ̀fẹ́ láti lọ sílé ìwòsàn yálà láti gbọ́ ẹ̀kúnrẹ́rẹ́, tí wọ́n sì ń ti orí ẹ̀rọ alágbèéká ẹ̀ tán fi ń gbọ́ ohun tó dára ni. Mo wá gbàládùra pé Ọlọ́run túbọ̀ máa ran iṣẹ́ yìí lọ́wọ́, yóò sì máa gòkè sí lágbára Ọlọ́run.
Àmín àṣẹ. We hope when next we invite you on this program, you are going to say yes to our invite.
Yes, please. Yes.
Ẹ ṣeun gan ni. Tó bá jẹ́ bẹ́ẹ̀, ẹ bá wa kí àwọn èèyàn kẹ́ bá wa dágbére fún wọn kó tún dìgbà tá láǹfààní àti pàdé.
Gbogbo ẹ̀yin èèyàn mi nínú ilé tó gbọ́ wa, mo dúpẹ́ lọ́wọ́ yín fún àsìkò tẹ́ fi sílẹ̀ láti gbọ́ nípa ètò ìlera, pàápàá jùlọ ohun tó ṣe pàtàkì sí àwọn obìnrin tá à ń pè ní menopause. Mo dúpẹ́ lọ́wọ́ yín fún àsìkò tẹ́ fi sílẹ̀, and I hope that next week you all join us for another interesting edition. Thank you very much for watching us.
Thank you very much.
You're listening to Faysol Oluwakemi Health Show.
So bó ṣe rí náà nìyẹn, òun lẹ ti gbọ́ yẹn lórí ètò fún tòní. Today's program, it's something that is very, very interesting to me personally. So mo dẹ̀ nígbàgbọ́ pé gbogbo nǹkan tí aláǹfààní láti gbéyẹ̀wò náà, òun náà ni gbogbo apátápátá àti rí ẹ̀kọ́ kan sí kejì àti rí múlò ńbẹ̀. I want to say thank you to every one of you for taking your time to listen to this program today. I want to appreciate you so much. Ẹ ṣeun gan ni tí ẹ tún bá wa gbìyànjú láti gbọ́ ètò náà fún tòní. Tó bá ṣe pé ẹ nífẹ̀ẹ́ bá ṣe lénìí, ẹ jẹ́ ká tún pàdé ní ọ̀sẹ̀ tí ń bọ̀ lágbára Ọlọ́run fún àkọ́tún ètò bẹ́ẹ̀. Don't forget, you can always send a feedback to us on how you enjoy this program. If there is anything, advice, you want to support us, you want to encourage us, you want to advise us on anything, you can always reach out to us on the number on the screen, or better still, send an email to us. We will always respond to your feedback. Bákan náà, gbogbo ẹ̀yin tí ẹ bá mọ Faysol Oluwakemi dáadáa láti ìgbà yìí wá, gbogbo ohun tó bá ní ṣe pẹ̀lú ìlera yìí, in tó jẹ mí lógún jù náà ni. So, we do organize Oluwakemi, and we discuss. It's a program discuss topical issues. It's an event where we discuss topical issues on our health, and we do some other service to humanity like free medical screen. A máa ń ṣe àyẹ̀wò ìlera fáwọn èèyàn lọ́fẹ̀ẹ́. Gbogbo àwọn tó sì di jàǹfààní wọ́n di ra àǹfààní yẹn jẹ dáadáa. Ọdún yìí a tún ti ń palẹ̀ mọ́, and this year is gonna be the fifth edition of the program. So for every one of us if you are willing to be part of it, to support us, to sponsor the event, so on behalf of all the production team headed by Yusuf Adebayo, on behalf of every team of, thank you very much for joining us on today's episode of Faysol Oluwakemi Health Show. Mo dúpẹ́ lọ́wọ́ Ọlọ́run tí ó tún jẹ́ ká tún rí ètò tèmi ṣe, ká tún ní ipa nínú ìgbésí ayé àwọn èèyàn fún tòní. Tí ẹ bá ní nǹkan kan tí ẹ fẹ́ bá wa sọ, ẹ fẹ́ ṣàtìlẹ́yìn fún wa ni, a fẹ́ ṣe ìgbọ̀nwọ́ ìkúnwọ́ fún nǹkan tá à ń ṣe tó jẹ́ nǹkan tó dùn mọ́ yín nú, tẹ́yìn náà fẹ́ ṣe ìkúnwọ́ fún wa lórí ẹ̀ lè kàn 27527 bó ṣe wà lórí àwòrán yìí. Lágbára Ọlọ́run, ìlera àti àlàáfíà wa kò ní di fíafíà. On this note, I'm going to say thank you once again, and this is where we're going to draw the curtain on today's episode of Faysol Oluwakemi Health Show. Faysol Oluwakemi ló kọ mi, Dokitomoye. Lágbára Ọlọ́run, ìlera àti àlàáfíà gbogbo wa kò ní di fíafíà. Thank you very much for listening. Keep sharing this video, like this page, invite people to like, and keep spreading this gospel. I really appreciate it so much. I love you.